Hello everyone, and welcome to Women's Health Chapter 3 on Health Promotion and Disease Prevention. This chapter is very integral in the health promotion for women, and even though much of the information can be applied to either men or women, we are going to correlate it with our own personal wants and needs in helping us to live healthier lives and also being able to prevent chronic illnesses and diseases. There is an old adage that reads, "An apple a day keeps the doctor away." And while that may not exactly be true, the spirit of that message is what you eat and put into your body will either have a positive or a negative effect on you. If you feed it with the right things, you won't have to see the doctor, or at least not that often. If you feed your body with the wrong things, then you may have more trips than the average person, and more trips also breaks down into more costs from an economic perspective. So we really want women to focus on good health and physical activity, putting the right things into our bodies, because there is another adage that says an ounce of prevention is worth a pound of cure. So keep that in mind when you think about the types of behaviors and foods that you're eating right now. Now, these are the leading behavior-related causes of death in the United States. And what we mean by behavior-related is that the things you do, the things you eat, the activities that you participate in, the stress levels that you carry, all mostly modifiable behaviors. These are the things which cause the largest number of chronic illnesses. And you can see how many are listed here: being underweight, unsafe sex, high blood pressure, tobacco consumption. And these are just the top of the list. There are also other aspects or other behaviors that are behavior related. And one of the huge ones is diabetes. So later we'll get onto the top 5 most chronic illnesses in the United States. But look at all of these behavior related causes of death and how many can truly be avoided and or prevented. When we look at being underweight or obese, whether you fall on one portion of the scale or the other, many of these factors are preventable just with the behaviors and the choices that we make with our own life. So it doesn't seem like it's a big deal when you're 20 or 25, but once you get up in age, you start noticing how your behaviors have a profound impact on your own health. When we're 25, our metabolism is sky high, but it doesn't necessarily stay that way when we get into our 30s. So do pay attention to how you are leading your life and the people that you hang around, because you will notice many differences as you start getting up there in age. Now, for this slide, there are a couple of very important aspects that I want you guys to focus on. I'm just going to bump down to the bottom real quick, where it says the United States is not as good when it comes to prevention. And this is kind of sad, seeing how we're a first world country, we're one of the superpowers. We should be at the top of the list when it comes to prevention. But even when it comes to things such as heart disease, lung cancer, chronic illnesses, upper and lower respiratory problems, we have excellent treatments. Excellent doctors. But we're not so good when it comes to prevention. And the prevention is what we are trying to promote the most, not getting sick in the first place. So it's actually more economically feasible for you to be healthy, because you don't have to spend as much money when it comes to care for the injuries that you really could have prevented on your own. Let's bump over to the actual cost breakdown. And I won't go over every single bullet, but you can see that prevention saves you money in the long run, particularly when it comes to things such as breast cancer or cervical cancer. These things can be detected in large numbers through routine pap smears and routine mammograms. Now, I know that it's not a comfortable test when you go in for your pelvic exam, but the exam itself can have a huge impact on detecting cancers at earlier stages, particularly when they're in stages 0, 1, and even stage 2, where the cure rate and the survival rate go up significantly, versus if the cancer was caught in stage 3 or 4, the mortality rate goes up exceedingly much higher, particularly for economic minority women, such as Hispanic or African American women. So it will be very important for you to keep up with those pap tests and those mammograms, because the incidence rate is higher for Caucasian women, but the mortality rate for some of these diseases are higher for minority women. So those are things that can play into your pocketbook, because we all know that health insurance is not cheap. And even though more people have health insurance under the Affordable Health Care Act, also known as Obamacare, more people have insurance, but it's still expensive. The low-income individuals will get the biggest break. If you have a lot of money, you don't really need a break. And then the large majority of people in the middle are kind of still left struggling when it comes to paying for some of their care. So prevention is going to be very cost effective, particularly if you have more than one person in your household. And I sort of talked about this before the slide came up, but we have differences between a morbidity rate and a mortality rate. And these are the differences. The mortality rate is the incidence of death in a given population. So basically how often, how often. And then the morbidity rate are the incidences of illness in a given population during a specific period of time, So it's kind of similar, but one has a shorter time break on it, and the other is a little bit longer. I really want you guys to focus more on mortality rate, because I probably will have questions on the test that touch on mortality more so than morbidity. And now I would like to get into I want to say it's 3 tiers of prevention. The first tier of prevention is the primary prevention. That is what's going to help you the most to avoid chronic illnesses and diseases. The first one is just limiting your exposure to risk factors. And those are the behaviors that you saw earlier in a couple of slides previous. Some of those examples include eating correctly, eating healthy. Half of your diet should be consumed with fruits and vegetables. 50%. And this is what the new plate that we see that is there for nutritional purposes. It used to be the food guide pyramid. Now we have the plate, and the plate says half of what you eat every day should be fruits and vegetables. So eating like that, because you have a lot of micro and macronutrients within fruits and vegetables, eating like that will really help. Number one, it'll serve as an appetite suppressant on its own because of the fiber and the water content. And also you'll be getting many vitamins and minerals within those fruits and vegetables. So it does help significantly in the prevention of chronic diseases and illnesses. Number two is regular physical activity. And you need about 150 minutes of moderate physical activity per week. It's a little more than 2 hours in order to lower your chances of obtaining one of the chronic illnesses that can lead to a premature death. And then we come to smoking cessation and safe sexual practices. So, of course, lung cancer has been proven many, many times to be related with tobacco smoking. And so there are also studies that link the smoking of marijuana or vaping. So anytime you're putting toxic air into your body, that's going to have a negative impact on you, even if you don't smoke. And not smoking is even more dangerous if you hang around people who smoke, because they're breathing in filtered air and you're getting all of the non-filtered air. So it's actually more dangerous to be around smokers when you don't smoke. And then, of course, limiting your sexual practices or practicing safe sex. And that one is a little bit self-explanatory, so we're going to leave it alone. Now we come to our secondary tier of prevention: early detection and prompt treatment. One of the best ways that you can detect is through the very uncomfortable PAPs and also mammograms and regular annual checkups. Unfortunately, we see higher rates of mortality in African American and Hispanic women when it comes to things such as cancer and stroke. We see higher incidence rates in Caucasians and higher death rates in minorities. And some of that is linked to socioeconomic status and access to health care. Even if you have health care, if you can't get to the doctor's office, then it's just as well that you don't have one. And so these are secondary tiers of prevention: early detection and prompt treatment. As I stated earlier, cancer can be treated very successfully in the 90th percentile as far as a cure rate when it's caught early, versus sometimes a 5% incident rate of people surviving when it's stage 4 cancer. So you see how the early detection will really play a vital role in not only preventing, but also treating diseases if and when they are discovered. And so a couple of other examples are listed below. Of course, we talked about the Pap and the mammogram. HPV, which stands for the human papillomavirus, that can also be a contributing factor to cervical cancer. And then, of course, using our medication after the diagnosis. Penicillin used to be considered a miracle drug, but because people kept taking penicillin for every single thing they had, then some people are either allergic to it now, they built up an immunity, and now it's not. So using your medications and not saving them for in case you have a headache later on, I'm going to take this Norco or this Vicodin or whatever other medication. So using your medicines appropriately, and then lifestyle behaviors, which include what you put in your body and the activity levels. And then we have our third tertiary prevention levels. So these take place once your disease has kind of advanced itself and has gotten to, maybe an uncontrollable type of care situation. Hospice care is an example of this third level of prevention. And it's really not so much prevention, it's more managing. So one is alleviating pain, providing comfort. Hospice care will do that. That is when there's nothing else that the physicians can do to you except make you comfortable. Sometimes it can halt the progression of an illness. It won't stop it, but it'll keep it from advancing. And it goes back to one of our other slides. Let me back up. When we talk about prompt use of medications after a disease is diagnosed. So if you use the medicine correctly, it can kind of slow down the process. So we know that certain chronic diseases and illnesses such as arthritis and degenerative disc disease and Alzheimer's, dementia, those are progressive. They're not diseases that can be stopped. And so we know that they're degenerative, but taking some medications can help slow the effects so that your lifestyle, you can live it a little bit longer and maybe a little bit more comfortably. And then, of course, we have a couple more: limiting disability after an injury, and then restoring function after someone has suffered an injury. And that is extremely important, particularly with stroke patients, because you often lose movement. You may have neurological issues after that. And so this level of prevention, while it will not it won't undo what the stroke has done, it can still help you in order to maintain your quality of life, or as high of a quality of life as you can possibly have. The reason why we often have intersections with race and economic status is because all of these aspects right here impact women's health, and they impact the type of care that you can receive. So in some situations, if you're poor, your health care will suffer. In some situations, if you are in a country that doesn't have health care, universal health care, and you can't afford it, then your health will suffer. Education is a huge one, because the more knowledgeable we become about our conditions, the more we can do to help prevent them without the aid of hospital personnel. And then, of course, employment, because many people they obtain health insurance through their employer. So if you're unemployed, not only do you now have a socioeconomic detriment, but you also may lose your health care. And so we can just see how that impacts women on a variety of different levels. This becomes even more of a concern for minority women because the state of the United States is constantly being changed, where before, when populations with Hispanic and African American women and men were at smaller numbers, we're seeing those numbers rise considerably. So by 2030, and that's just 12 years away, 20% of American women will be Hispanic. Latino Hispanic. That's very significant. 1 in 14 will be Asian. 1 in 4 women will be over the age of 65. And so that's 25% of women who will be senior citizens. So our health care, in order for the United States to be healthy, we have to focus on the health care of women, and especially when it comes to the aging population. Let's look at how much populations have changed. So we see that over the years, as we get closer to 2030, which is in the yellow, you see how much the face of America is changing. You see how diverse we are. And so this is an estimation between 1995 and 2030 about where our populations will look. And we see that there are so many different ethnicities And we have to be able to touch on all of those and educate individuals on all of these aspects so that they know in my community this may be a problem.